What's up? It's your boy Med Hustle, aka Dr.G. Welcome to another episode of the Med Hustle podcast. We're chilling here in the vault, one of the vaults, and just reflecting on the process and the growth, and trying to re-project the direction of all this medicine stuff. Where is it going, and where's the future headed? There's a lot of uncertainty, and there always is, and that's a good thing. That means things are changing. When there's too little uncertainty, I think stagnation occurs and people get used to patterns, and us humans love being in patterns, and there's not much growth in that once you start to hit cruise control. So the future is exciting. It's unknown. That's what makes it exciting. But how does medicine fit into the picture? And recently, as of this past few weeks, the social media platform Facebook has rebranded into Meta. And Meta represents the Metaverse. So what that means is in due time, people are going to start having goggles, whether it's glasses, goggles, or even contact lenses, where you live in this digital world of augmented reality where you can watch this video, figure out everything about me, figure out my stats, my videos, subscribe. You can talk to your glasses and say subscribe, or take me to his video, or things like that, and you can immerse yourself in these different virtual and augmented realities. So technology is taking a big leap, and these patterns have been projected previously in sci-fi and cartoons and things like that, but it's exciting to see it come to fruition. How does medicine fit in this picture? Right now, medicine saw its biggest upheaval in the sense of the coronavirus and having telemedicine be yanked into the forefront because a lot of patients needed to be seen. There was a lot of demand, not much supply, so these hospitals needed to rewire their infrastructure in terms of telecommunications and how their offices are built. Put in more webcams, put in more iPads, put in more applications where a patient can log into their app and reach their doctor. Now we have waiting rooms that are digital, telephone visits, video visits. So a lot of that has expanded. In fact, when I was in med school, I had a passion for trying to access these vulnerable populations in these pockets of different states where they have to drive 3-4 hours to get to a doctor. And I always had an interest in, hey, let's get these people telemedicine, but I was just a med student, and I met with a few people, but that idea never came to fruition because, one, I didn't have funding, and two, I didn't have any mentor who believed in my idea or said, yeah, go run with it. Here's some funding, here's some guidance, here's some research. So, but those little attempts always lead to framework and infrastructure and scaffolding. So as you develop your identity going through medicine, I just want to share with you, if you don't know by now, the whole landscape is going to shift into a new framework that is very, very digital. For example, you may or may not be able to become a completely independent practicing physician through telemedicine. You don't need insurance, you don't need anything. You just have patients come to your website and they sign up for your services. Right now, there's a teeter-totter between what is the gray zone of business and medicine. The ethics and business kind of are mixing like water and oil. There's a lot of murky grounds. How do things like this happen in terms of patient privacy, HIPAA compliance? How do you protect patients' records as an individual? If you start your own company, do you have the software infrastructure to prevent hacking of this private vulnerable data? Social security numbers, people, for example, with psychiatric histories, you don't want this information to be out there or vulnerable to attacks. And each hospital has a lot of money in IT funding and a lot of IT specialists who always prevent phishing and malware and things like that. So as you develop yourself, how do you get your company to be prepared for that type of infrastructure? That's one piece. The second piece is, what type of doctor do you have to be to attract a population independently of a hospital? So a lot of doctors, we are challenged with spending a lot of time working on our skill set, but zero time working on any business skills. And in fact, your social skills have to come on the go. And in my opinion, you can develop some social skills. As a physician, you will definitely grow and mature so much. But based on your seed, your foundation, you either got it or you don't. And that's just the bottom line, in my opinion. And that can be a debatable point based on people who may have transitioned from introvert to very successful extroverted leaders. And I believe that can happen, but no church in the wild, as Kanye says, aka you can't be a lone wolf. You don't learn that on your own. You have to either have a mentor or someone pushing you in that direction, internal or external. But the question is, how does this metaverse, this Facebook stuff, this social media stuff, how does it translate into medicine? Because now people, for example, in catastrophe regions, Syria, Afghanistan, different regions in South America, Venezuela, things like that, when their infrastructure breaks down, they use programs such as WhatsApp to share CT scans, x-rays, pathology reports, send it to the experts feedback, medicines, communications, telemedicine across oceans. So these things are happening, but we don't want them just to happen in catastrophes. I think we have to revamp the way the entire network is built. And one of the debates that I've heard about healthcare is that we have to accept the integration of big hospital corporations with pharmaceuticals, with insurance companies, with third parties. They're acting like this is how medicine is built, and we have to accept this framework and adapt to it. And I am of someone who would argue completely against that and say there is no infrastructure that's permanent. I never get married to any ideology. If you tell me this is our infrastructure and it's very faulty and it's on shaking grounds, you can't tell me that's how it's going to be. I'm going to create the infrastructure. And the infrastructure that I choose to create it is in favor of the patient. And I'll tell you my deepest and most sincere satisfactions throughout this whole burning journey in medicine so far. From pre-med to med school to residency, now almost finishing residency and hopefully going to fellowship. This whole path, the most satisfying pieces were two things. One, the novelty of adrenaline rushing experiences like being in the OR, doing procedures, intubating, placing central lines, taking out tumors, meeting interesting people, meeting manic people, meeting suicidal people, meeting happy people, meeting sad people, meeting obese, anorexic, every single type of person, people with tumors on their face, people with gunshot wounds to the face, every single type of person you encounter, and you digest it. You digest it into your personality, you digest it into your perception of society. And once all that is digested, then you say, okay, who does that make me as a person? Who am I now after I've seen all of this? Where do my beliefs stand and what are my principles? The problem is the path in medicine is so rapid and it takes such an emotional, mental toll out of you. There's not much time to digest. There's not much time to audit yourself and say, let's line the ducks up. Let's put the chessboard together. And frankly, this video in itself is part of that process for me. This video of itself is helping me decompress, helping me figure out what it means, because it may seem like I'm making this for an audience, but really I'm talking to myself. I'm talking about how I feel and what I need to figure out, and I'm just sharing it. And the reason I'm sharing it is because I think putting out the energy and the ideas will attract similar minded people who will then create a flow state towards that reality. So that's the way I perceive life. The medicine piece And the biggest source of gratitude, which I haven't yet said, is the gratitude of a patient for making a patient's day better. Aside from all the thrill from medicine, from the joy from that and meeting people, when a patient tells you you made their day better, you made their life better, you gave them hope, that has such a beautiful, beautiful weight on it. And it's such an uplifting, energizing boost that can carry you through the darkest shifts, the night shifts, the traumas, the ICUs, the people on ECMO. You go through all of that and you still carry hope. And that's what energizes me. And I'm thankful about all. I have never forgotten one patient who told me that I changed their life. I remember all the big moments where they told me how significant the encounter was. And that makes me so happy. And the reason I bring that up as the biggest source of happiness is because if that's my biggest source of happiness and enthusiasm and joy for the craft of medicine, then I will surely base that goal as the foundation and principle of the business model. What's my business model is to satisfy the patient with hope, with comfort, relief, take away the fear. That's the main principle of any medical endeavor that I embark on. Anything beyond that, any shift or trajectory away from that core will be a faulty foundation. It will be a faulty energy that leads to crisis, that will lead to, problems financially, problems with relationships. So my goal and hope is to maintain the highest caliber of relationship with my patients. And only God can see the types of relationships I have built with my patients, of how genuine they are and how meaningful they are to me. And every encounter, every day I go into a patient encounter, I come in with that attitude and I try to uplift it. As much stress as I have in my life, as much problems as I have in my life, when I go into that patient room, the whole narrative flips. I'm there in terms of service, and only can a universal spirit, whether it's out there or not, only can the universal flow, the state, the organic, matter in the universe that we are all a part of, that essence, the ether, gives me that energy, and I'm very thankful for that. And I recognize that's a gift and not something that can happen any day. So I recognize that, and I'm thankful for the God that likely exists, in my opinion. Which can be a whole nother topic, and we can break down why that is. We can break down the philosophy and start talking about particle physics and things like that if you like. But I think humans statistically have a problem absorbing the spectrum of our universe, which I don't blame them. But one thing I do recommend for anyone who is embarking on the medical hustle, the med hustle, the pre-med, the medicine, the residency, surgical, not surgical, attending life, family, all this stuff. One thing I do recommend is have a love for the people. Never lose your love for the people, because you got to be one with the people. And it's very obvious when someone's not one with the people. Very obvious. And beyond taking care of the patient and being one with the people, your next level, the next level has to be being able to take care of the team, being able to take care of your community who you work with, the other workers, the janitors, the nurses, the techs, the echo guy or girl who does the echo for your patient. All these people, the pharmacist, you have to know how to navigate that dynamic as a leader and what your role is, and the balance of respect, the balance of roles, knowing how when you get stepped on, know how to step back appropriately, knowing to identify everybody's roles and identify your role and what it means when a decision is made and how it gets executed. So these things are all on the go. That's why the training is so long. There are so many intricacies in this game. And it's so intense because if you filter down everything, the amount of patient care that takes place, I really think 15% of all of medicine is patient care at this point. 15% is patient care. The rest is a machine. It's a machine that is running at a very rapid pace, and everything needs to be well oiled, and any crack in the cogs will cause domino effect in any direction. And there's always domino effects taking place that get patched up. Root cause analyses, those take place all the time behind the scenes. Infection control takes place all the time behind the scenes. Auditing by third parties, Medicare audits where they come in and say, hey, you spent this much, you had this many infections, we're not funding the cellulitis pathway, we're not funding heart failure, you have too many readmissions, all the politics and the deals being made with different pharmacies. Hey, this insurance covers this region, this insurance company does not cover this zip code. Then we start talking about people who live in a zip code that doesn't have insurance coverage. There's a lot of complexities to the game, and it's overwhelming, but there has to be a burning desire to understand all these pieces. So when you have a class of 200 plus people in med school, you're going to get all the different personalities, different leader types, different levels of OCD, different levels of chill, different levels of communication. But what is a common theme, that nobody gets the business education. Nobody. Some pursue MBA. I don't know how much that's useful, because that's not really a master's of medical business. That's just a master's of business. I can't speak on it because I haven't done it. But I encourage anyone as a doctor to learn how the landscape occurs. But not only learn the current one, learn how it started and learn what you think it's going to be. And find joy in that. If you don't, that's okay. Stay an employee. My goal is to encourage anyone who has a little bit of drive, talking to myself once again, talking to myself to gain the drive to develop independent knowledge about the healthcare system while I'm still in it. And this whole documentation process is to kind of break down a burst of perspective at this level of training as a PGY3 internal medicine resident, to let it out and see what I learn in the future and just document it as a checkpoint. So thanks for listening. I hope this was useful for me or anyone else out there. I may or may not put this on YouTube. I may or may not share it on social media. There is a goal of building a brand where I can be present for my patients who I've already built relationships with, and build a network of patients who can see that Dr.G is at your service. The main philosophy is making sure the patient's satisfied, making sure the patient has hope and comfort and hope for a healthier future. So, med hustle. Peace.